start the statement on the National Cancer Plan. Minister.
Thank you. Madam Deputy Speaker, with permission, I will make a statement on the Government's National Cancer Plan for England. A cancer diagnosis changes you forever. When I was diagnosed with metastatic breast cancer 18 months ago, I didn't know if I'd be alive today. Never mind standing at this dispatch box announcing a national cancer plan. But 1 year ago, almost to the day, the Prime Minister asked me to do just that. Madam Deputy Speaker, since the government took office, over 212,000 more people are getting a cancer diagnosis on time. Over 36,000 more are starting treatment on time, and rates of early diagnosis are hitting record highs. Despite these vital signs of recovery, the NHS is still failing far too many cancer patients and their families. That's why, first and foremost, this plan is a break with the failure of the last 15 years. In 2011, the coalition government published Improving Outcomes: A Strategy for Cancer. It was followed in 2016 by Achieving World-Class Cancer Outcomes: A Strategy for England. In 2019, the Long-Term Health Plan for England made cancer a priority and included a headline ambition to diagnose 75% of cancers at stage 1 and 2. However well-intentioned, not one of these strategies have lived up to their promises. Cancer mortality rates in the UK are much higher than in other comparable countries, while survival is much lower. Cancer incidence is around 15% higher than when the 62-day standard was last met. And working-class communities are being failed most of all. The most deprived areas, including rural and coastal communities, often have fewer cancer consultants, leaving patients waiting longer. And it all adds up to the chilling fact that someone living in Blackpool is almost twice as likely to die young from cancer than someone living in Harrow. Madam Deputy Speaker, wherever you live in our country, you deserve the same shot at survival and quality of life as everyone else. Wealth should not dictate your health, and neither should your postcode. And behind these statistics are real people. I've heard from those whose care lacked empathy and dignity, whose cancer was missed or test results lost, who were passed from pillar to post and kept in the dark about their condition, and those whose loved ones died before their turn came for surgery because the wait was too long. Those experiences are unacceptable. They are devastating. And from day one, I was determined to put their voices front and centre of our plan. Over the past year, we've listened to and learned from cancer charities, clinicians, and most importantly, patients and their families. Every action is a response to someone's lived experience. Every commitment is a promise to transform someone else's life. And their stories have become the blueprint to make the biggest improvement in cancer outcomes in a generation. Madam Deputy Speaker, 3 major themes stood out from the 11,000 responses to our call for evidence, around 9,000 of which came from patients and their carers. First, on core performance standards. Second, improved survival. And third, quality of life after diagnosis. And Madam Deputy Speaker, these are not radical ideas. But unlike previous strategies, this plan is not limited to incremental improvement. Instead, it is an ambitious, bold plan to save 320,000 more lives by 2035, the fastest rate of improvement this century, by modernising the NHS, harnessing the power of science and technology, and putting our patients at the front of the queue for the latest medicines, while helping them to live well after diagnosis. Not least for people diagnosed with stage 4 metastatic and incurable cancers, people like me. So how do we get there? We're placing big bets on genomics, data and AI, as set out in our 10-year plan for health. And we will hardwire the 3 shifts of our 10-year plan into cancer pathways. First, on analogue to digital. We heard from patients about the importance of clinical trials. So we will make the UK one of the best places in the world to run a trial with a new cancer trials accelerator. We will start people's care earlier using liquid biopsy tests, which can turn results up to 2 weeks faster than conventional testing. We will harness AI to read scans, plan radiotherapy and identify the right path for each patient. We'll harness genomics so every eligible patient will have access to precision medicine. And we will harness data as we make sure all metastatic disease is counted properly, starting with breast cancer, so that people with incurable cancer are properly recognised and supported. When you're not counted, it feels like you don't count. We will end that. Innovation will also help us fight inequalities and make the shift from sickness to prevention. We'll turn the NHS app into a gateway for cancer care. By 2028, it will host a dashboard for cancer prevention with access to tests and self-referral. And by 2035, it will bring together genomic and lifestyle data with the single patient record to advise every patient according to their risk. This will benefit people in rural and coastal communities that can find it difficult to access specialist care simply due to geography. Finally, we'll use the neighbourhood health service to make the shift from hospital to community. That means more care, more pre-habilitation to recovery support will be delivered closer to home. We'll help people live well with cancer through tailored support closer to home. People will be given personal cancer plans, named neighbourhood care leads, and a clear end-of-treatment summary so no one feels abandoned after their treatment. Madam Deputy Speaker, for too long, those with rarer cancers have seen little to no progress for many of their conditions. They told us we need a special focus on these cancers, and our plan sets out how we will benefit from the deployment of genomics, early detection and the development of new treatments. Asked for by patients, delivered by this government. And I can pay tribute to the campaigning of my honourable friend, the member for Mitcham and Morden, for her campaigning in memory of her late sister Margaret. We should also remember that the late Tessa Jowell raised this issue in 2018 and her family's campaigning ever since. Our plan also gives pride of place to children and young people. We'll improve their experience of care at every level, from hospital food to youth worker support and play support. And I pay tribute to my honourable friend, the member for Leighton and Wanstead, for his campaigning on this point. Our Children and Young People Cancer Task Force asks for support with travel costs, because when your child has cancer, the last thing you want to worry about is how you're going to pay for your train ticket. So today I can announce that we will fund those travel costs. And alongside rare and less common cancers, we will make research for children and young people a national priority. I want to take this moment to thank the children, young people and families that made up our Children and Young People Cancer Task Force. It was a pleasure and a privilege to meet with them earlier this week. And I thank the families and loved ones of people lost too soon that continue to fight to make change for others. I'm so grateful to them. And as people read this plan, it's their voices I want people to hear, because this plan is rooted in the voices of patients, families, clinicians and charities. It will turn cancer from one of this country's biggest killers into a chronic condition that's treatable and manageable for 3 in 4 patients. It delivers the ambition of the 10-year health plan, embodies the government's 3 shifts and sets a clear path towards earlier diagnosis, faster treatment and world-leading survival rates by 2035. But this plan doesn't belong to the NHS, and it doesn't even belong to this government. It belongs to us all, and we must all play a part in making it work. Over the past year, I've met with the patients, families, carers and clinicians, researchers, cancer charities and voluntary groups who have all contributed to this plan. This government is on their side. We wrote this with them and we can't deliver it without them. Let's do this together, and I commend this statement to the House.
Shadow Secretary of State.
Thank you very much, Madam Deputy Speaker. And can I thank the Minister for her advance sight of her statement. Can I say right at the outset, we share the ambition to improve cancer survival and outcomes. Almost every family in Britain has been touched by cancer, and patients do deserve timely diagnosis, treatment and proper support. I also want to recognise the Minister's personal experience and the commitment that it has clearly brought to this agenda, and we on this side of the House wish her every success for the future. And can I also join her in thanking all those that have taken part in the shaping of this. It does make a big difference when we hear the voices of patients and families that have been through these experiences. The National Cancer Plan sets out major commitments, including early diagnosis, improving performance against cancer waiting time standards, faster setup of clinical trials, and the national rollout of targeted lung screening. Now, it also talks about modernising services through technology and innovation. Now, as Cancer Research UK has said, there is much to welcome in this. But as I've also said, it's right for them to say that delivery, funding and accountability will determine whether patients see change. So, because too often plans do sound impressive on paper, but fall short when it comes to clear, published delivery milestones and accountability. In many respects, this plan mirrors the ambitions of the 10-year NHS plan, strong on aspiration, but light on the detail about how change will actually be delivered on the ground. So my first question is simple. When will the government publish clear, funded milestones showing how and when patients will see improvements in the next year or two? We welcome investment in diagnostics, technology and innovation. It is also right to recognise that this plan builds on the significant expansion of diagnostic capacity delivered by the last Conservative government, including the rollout of over 160 community diagnostic centres. Earlier diagnosis on this scale is only possible because of that foundation. But technology is only meaningful if it translates into real capacity and quicker treatment for patients, and that is why radiotherapy matters. Radiotherapy UK is right that it is a core part of modern cancer care that relies on up-to-date equipment and a skilled workforce. So my second question is this: will ministers set out how the plan will expand radiotherapy capacity in practice, including equipment replacement and workforce, so that patients can benefit in reality rather than just something written on paper? And are we learning the lessons from the Danish example, who put investment into radiotherapy and saw significant improvements over a period of years? And that brings me on to the workforce. The success of this plan depends on cancer nurses, radiographers, pathologists and oncologists who are already under immense pressure. We've heard big promises before, but less clarity on delivery. And so my third question is this: where is the fully funded long-term workforce plan to deliver the staffing needed to expand diagnostic and treatment capacity and sustain improvements, including in neighbourhood health centres, and to explain clearly who will staff them and how they will be funded? Blood Cancer UK has highlighted the importance of ensuring blood cancers are properly recognised in planning, and that patients receive consistent support from the point of diagnosis, including access to a named healthcare professional. And that underlines why delivery and accountability across the system matter so much to patients. Can I also welcome the commitments in this plan to children and young people? And I want to pay tribute to my honourable friend, the member for Gosport, who I know did some incredible work in this. Having worked in children and young people's hospices, you can never forget the journey that those children and their families go on, and I'm really grateful to the government for having a big section on that. My fourth question then is about life after and at the end of treatment. The plan rightly talks about improving quality of life and support after treatment, including personalised support and rehabilitation. We all want people to live longer, but for many patients and their families, hospice and palliative care are essential. Yet hospices across the country are under severe pressure, with now many in crisis, exacerbated by recent government tax rises, hitting staffing and running costs. They are hospices are notably absent from today's statement. So will the government urgently convene a crisis meeting with the hospice sector and set out what immediate steps it will take to stabilise services and expedite delivery of the palliative care plan? We will support any serious deliverable reforms that improve earlier diagnosis, speed up treatment, strengthen the workforce and improve patient experience. But we'll also hold ministers to account for turning long-term ambition into real improvements now, because we do want to see the patients getting the care that they need.
Minister.
Thank you, and I thank the honourable member for his statement and questions, and particularly for his personal wishes. Thank you, thank him indeed. On the overseeing of delivery, it is absolutely crucial. You know, great, we've written a plan. What matters is delivering it. And, you know, we started delivery even before we'd finished writing this plan. We're not waiting. We've already put 200 million directly to cancer via cancer alliances. We've recruited 2,500 more GPs. We've put in place 28 cutting-edge radiotherapy machines already and are already rolling out lung cancer screening. We've opened more community diagnostic centres at evenings and weekends. We said we'd deliver 2 million more appointments. We've already delivered 5 million more appointments. And we've put £25 million into the NIHR Brain Tumour Research Consortium. So there's already steps that are being taken. And it is really important, as he points out, that we are held to account and that people keep our feet to the fire on delivery. That is why we are setting up a brand new cancer board of charities and clinicians that will oversee the delivery of this plan and keep our feet to the fire. On workforce, we know how important it is to make sure that the cancer workforce is grown and developed, not only just in numbers, but in terms of being able to have the resources and the support to use their skills to the utmost. The workforce plan that the government is developing will also include cancer and will be published in the spring of this year. I was delighted to hear the honourable member mention rare cancers and children and young people. This is the first ever cancer plan with a chapter on rare cancers. It's the first ever cancer plan with a chapter for children and young people, and I'm really proud of that. In terms of radiotherapy, as I said, we've invested 70 million into 28 new LINAC radiotherapy machines, and we've listened to stakeholders in the radiotherapy community. We're investing in new technology, including those radiotherapy machines, and in AI, which assists the oncology workforce to reduce the time it takes to plan and then deliver treatment. And by April next year, we will streamline the process to make it easier for radiotherapy centres to use cutting-edge stereotactic ablative radiotherapy, SABR, which I know is of crucial importance to many patients. And we're also going to ensure a payment system associated with this treatment incentivises rapid adoption. The honourable member mentioned hospices, which I know is very close to his heart and his experience. We are delivering the biggest investment in hospices in a generation. We've provided 100 million to upgrade buildings, facilities and digital systems, and we're giving a further 26 million to children's and young people's hospices, ensuring they can continue offering specialist compassionate support. More broadly, we are developing a palliative care and end-of-life modern service framework for England. It's currently being developed alongside our stakeholders with a planned publication date of autumn 2026. I hope that addresses most of the issues raised by the honourable member, but I'm more than happy to speak with him further after the debate.